As you can see in this operation, we've drawn the incision along a skin fold approximately 1 finger breadth down from the cricoidal cartilage. And you can see drawn also is a sternal notch. Here we're administrating local anesthesia, 0.25% marking, 2.5 cc's above and below the incision. So it does not get into the way of us using cautery in the incision. Next, we make a 4 centimeter incision, 2 centimeters off the midline on each side with a knife, and then we use cautery to go through the subcutaneous tissue and divide the platysma. In the next step here, we are dividing the strap muscles vertically using cautery. And we divide it as far superior and inferior as possible to give us the most access to the thyroid. Next step is taking down the upper lobe, which we do bluntly, going in between the space between the trachea and the upper lobe using a sucker and a Kittner. And once doing so, we then retract that space down, and then we are going to use the CoolSeal to come up high and double seal the upper pole vessels. And you can see here we're applying the seal to the upper pole vessels, and we seal them twice, and once distantly, one proximally, and then divide it. And often it takes a few. And the nice thing about this instrument, it's curved and long. As you can see, it provides good visualization as you're sealing, and plus the added length of the instrument allows us to get high to the upper pole. Next, after dividing the first series of upper pole vessels, we use an Alice clamp to grab the upper pole, and then we further come down on the top of the upper lobe of the thyroid with the CoolSeal, again with the double sealing, and that allows us to bend over and then seal the vessels coming in the back. And often we will see the upper parathyroid gland in doing this maneuver, and we can use the CoolSeal to gently push it out of the way, and also the sucker, as we show in the video, we push that out of the way and we seal very close to the thyroid. And in doing so, we're able to mobilize this upper lobe completely down. And this is us finishing the sealing of the upper lobe. Okay. Often there is a vessel coming just on the lateral edge of the upper lobe, and we also can seal that. Here we shift, and now we've taken on the upper pole, which the Alice clamp is, and then we will grab the lower pole of the thyroid and gently retract medially to roll the thyroid gland over. Often we take the middle thyroid vein in doing so. And here we are isolating the middle thyroid vein. And unlike the upper pole vessels where we seal them twice, here, because it's very visualized, we are very confident in having the CoolSeal just seal it once and then dividing. After this maneuver, we sweep the tissue over, and then we are going to gently dissect out and identify the recurrent laryngeal nerve. And typically we find the nerve just medial to the upper parathyroid gland, and we'll create a space, and you can see here we've clearly identified the recurrent nerve, which is posterior to our instrument. And what we are doing is dissecting all the tissue sitting above the nerve and dividing that tissue, which is often small vessels, with the CoolSeal. And we dissect the nerve in its entire path. Once after dissecting the nerve out, we take the remaining attachments superiorly with the CoolSeal. And again, mentioning often the upper parathyroid gland can sneak up into the field, and here you can just push it away as I've done there. And again, the advantage of the instrument is to be able to use it as a little bit of a dissector. And here we go ahead and seal the final vessels going up near to the upper parathyroid gland and clearly mobilizing it out of the way. Okay, after we have mobilized the upper parathyroid gland out of the way, we're taking down the remaining attachments to the thyroid, and what we're going to be looking for is the lower parathyroid gland. And in mobilizing the lower parathyroid gland off the thyroid lobe, it's very important to maintain its vascular supply. So again, the CoolSeal is very good for this, as both it can be a dissector where we can push away the lower parathyroid gland and then divide the vessels in the tissue that are keeping it adherent to the thyroid gland. Finally, the last step is once you've dissected the nerve and freed the lower part of the thyroid gland away when they're both being retracted in the air, we leave for the final attachment the ligament of Berry, which is often crossing over top of the nerve. And here we find the CoolSeal a great instrument to be able to dissect the ligament of Berry because it has fine teeth, you can spread, and because it doesn't create any, it doesn't get hot, we can stay above the nerve like that and just seal the ligament of Berry, taking often there's one or two small vessels within it, and that you can see as we seal, the gland is released and the recurrent nerve falls away, and it's very effective because you're sealing the vessels and you're dividing at the same time.